As usual, I've had technical problems. It seems to follow me like a Charlie Brown dark cloud. My apologies, Dr. Ryan. Are you there?
I'm here. Thank you, Mark.
All right. Well, let's get right down to it. I just wanted to step back, first of all, and ask a wider vaccine distribution question. And I know you don't really have an answer to this, but I've heard a number of people, and my wife included, who have had to scramble around to a number of different sites. Clear Creek County's got a great site now for signing up, and there are many, many others throughout the state. I just wonder why there isn't a statewide registration site. Colorado knows where the vaccines are to be distributed. The state could direct registrations to match vaccine allocation sites. I just wonder why that, after all this time, we're still have this fragmented system. I'll let you try to answer that.
Well, I don't know that I have a clear, coherent answer for that one, other than the fact the state does have a website where it shows a map of the state, and you can click on a county and then find out where in that county vaccines are being disseminated. So, for instance, if you clicked on Clear Creek County, it shows local public health, which is us, and then it shows the Safeway Pharmacy in Idaho Springs as the two administrators of vaccines in the county. So, from that perspective, it does. The state has required or allowed, I should say, each county to manage their own process. We're now all plugged into the same system, the PrepMod system that we're now using. And some counties do allow them, their clinics to be open to the public, so that all someone has to do is go to the PrepMod webpage and they can see all the ones that are completely open to the public. Now, the Clear Creek County one, the only way to get to our PrepMod page is to go either through the Clear Creek County Public Health website and click on the link, or on our Facebook page. But then again, you have to be a follower of our Facebook page. So we've created a little bit less public and a little more private way to get there, just so we're not completely inundated with folks. But I think the state's trying to create a little bit of flexibility for each county, as you know, all counties are created unequally in this state. Ranging from very large ones like Denver down to really tiny ones that have no more than 500 people in the county. So that's as best of an explanation as I can get. And right now, the system seems to be working pretty well in terms of identifying folks, getting them signed up based on the tiers that they might fall into and eligibility, and then getting them vaccinated.
Well, I know that our county's done an exemplary job of identifying folks who are eligible for vaccines and trying to get them on the list, and then actually vaccinating them. And kudos to you and your staff and everyone else who have been involved in that process. It really has worked well. It just is. I worry that people will become frustrated if they've tried and been denied a reservation for vaccination a number of times, which seems to be fairly typical for now. But I know that there are more vaccines coming. Can we speak to that for just a minute?
Absolutely. So, one thing we're asking people to do is be patient. We have the tiered system for a reason. We're trying to get folks vaccinated who are of the highest risk of hospitalization and risk of dying. Once we get those folks vaccinated and those who have the greatest amount of exposure, we can move on to the general population. Until we get there, patience is going to be required. This state allocation that we get from the federal government, according to the feds, is going to be more than doubling in the next several weeks. So we're hoping that trickles down to Clear Creek County, and we continue to get an increase in the number of doses that we're receiving each week. As you know, last week we vaccinated close to 2,000 people, a significant jump up from what we had been receiving prior, as 100 every other week. Tomorrow we're going to attempt to vaccinate close to 700 people at our clinic. So we're ramping up quickly, and we're hoping that continues over the next several weeks so that we get through that Tier 1B3 and then get on to the 1B4. The sooner we can do that, the better. The more society will open up, and things will continue or move towards a more normal than they have been.
Yeah, not only were close to 2,000 people vaccinated last week, but most of those were with the Johnson & Johnson, I understand, and those people are completely vaccinated. I just can't stress that enough, how important that Johnson & Johnson vaccine is. One dose and done. All the administrative work to get people back in line for a second shot, not to mention that 2 shots means half the number of people are completely vaccinated. It's just an incredible boost to the vaccination percentage to have that Johnson & Johnson. And I understand that there are more manufacturers that have agreed to help produce the Johnson & Johnson. What can you tell us about that?
Absolutely. So the Johnson & Johnson or Janssen vaccine, they sent out every manufactured state. So, the course of 3 days, the state over 44,000 individuals with that single dose. What it's done, though, is it's created now a 3-week lag between now and when we might see Johnson & Johnson vaccines again. They're ramping up production, both Janssen, but now Merck has agreed to manufacture the Johnson & Johnson vaccine as well as another company. So there will be 3 companies starting literally this week to manufacture that vaccine. So we're hoping by the end of the month we receive another allotment of that vaccine, and then that allotment only increases over the next several months. That vaccine, as you suggested, logistically, it's far simpler for us. It's one and done. We don't have to follow up with people and make sure they get back for their vaccines. You're also getting to that level of immunity that's significantly protective much quicker than you do with the Moderna and Pfizer vaccine, primarily because 2 weeks after your vaccine, you're at that point. It's not 6 weeks later after your second vaccine that you're getting that. So it's been a huge improvement in terms of the numbers we can vaccinate in any given week, and it's also logistically much simpler for us.
Well, you have described your crystal ball as cracked in the past, but I'm going to ask you to look into it again. When do you think we might reach a point of some level of immunity statewide?
Well, right now, as you know, we're vaccinating a little more than 2 million people a day in this country. As far as Colorado is concerned, obviously that number is only going to increase with each week, based on my earlier comments about the supply doubling in the coming weeks here in Colorado. And if we're receiving 400,000 plus vaccines a week, particularly if the majority of those end up being the Johnson & Johnson vaccine in the next month or so, that will help us jump up 300,000, 400,000 fully vaccinated folks per week. And in a state like Colorado, it won't take long before we can reach that level of community immunity and be able to resume life as we knew it before. One point about that, though, I want to make, and we stressed it at all our vaccination clinics this weekend, a vaccination vaccinates and protects you as an individual. It does nothing for those around you. So it's absolutely critical that people continue to wear their masks and continue to do what we've been doing for the last many, many months. It's going to be a little while longer until we can get our vaccination numbers up to where we approach that community immunity level that we can only then begin to take our masks off. So right now the governor is doing the right thing from a political perspective and keeping that mask mandate across the state in place. We know some of our neighbors are not. I think that's a grave mistake. I think it's only going to open the door for an increase and spike in the cases. And with variants the way they are now, We know here in Colorado we have the UK variant and the South African variant. Both of those much higher transmissibility rates, and literally things could turn around in the wrong direction over a week or two time, given that. So keeping that mask on, socially distancing, and doing what we've been doing is a critical component added to the vaccination plan that we're implementing right now.
Yeah, the vaccine, the variants, have been spreading pretty quickly throughout the country. That's a concern. As we race to vaccinate, we're trying to beat the variants to the finish line, and it sounds like we've got a good chance if people will continue their desires to become vaccinated. I think the point is going to come where we'll have everyone who is eager for a vaccine vaccinated, and I have high hopes that that's going to be within maybe even 6 weeks from now, and then comes the tough nut to crack, the folks who aren't necessarily inclined to become vaccinated or can't become vaccinated. What do you think might be some strategies that might encourage folks to become vaccinated?
First and foremost, word of mouth. We've seen this in spades with our early vaccinators, or folks that got vaccinated. There was some hesitancy within even those groups. But once folks got vaccinated and they talked to their neighbors or coworkers and said, I'm fine, nothing happened to me, I feel much more safe and secure now that I have been vaccinated, and nothing, I didn't have any side effects or whatever. That alone will have an impact on that tough crowd to convince them. So it's incumbent upon all those who have been vaccinated to reach out to family, friends, and neighbors who haven't been vaccinated or who are hesitant to get vaccinated. It's an absolutely critical piece. We do know there's a segment of our population that is very hesitant to get vaccines. So it seems, though, that a number of those folks who normally wouldn't get vaccinated for the flu or something like that are, in fact, now getting in line to make sure they're vaccinated for COVID, recognizing and realizing the potential danger that it poses without being vaccinated. So,
yeah, I'll just throw in my personal observation. I always had a great desire to become vaccinated, but it's just the emotional relief that you feel once you've been vaccinated. It's just another world. Anyone listening who hasn't been vaccinated, I can't wait till you have your opportunity to feel as good as I felt when I became vaccinated. I'm not bulletproof, but maybe I've got a bulletproof vest. How's that? I heard you say on your report this week that the number of cases throughout the state, although they have taken a dramatic decrease from what they were at their peak a couple of months ago, we're still double the cases from last summer. I wonder if you could speak to that for a moment.
Yeah, absolutely. So, as you know, and most people know, over the last 6 weeks or so, we've seen a dramatic drop in the number of daily cases and hospitalizations and deaths in this state, as well as across the country. That dramatic decrease has actually stopped. We're no longer in a decline. Last week, we actually had, or 2 weeks ago, I should say, we had an actual increase in number of cases per week. And now, this week, it has plateaued, meaning it's not going up or down, it's staying where it is. The problem with that is that number is significantly higher than it was last summer, right before we went into that massive spike in the fall. So at 1,200 per day, that's far higher than we would like it. We would like it in the hundreds, low hundreds if possible, before we can continue on with life as we knew it before. When you get to that level of a few hundred a week, it's manageable. We can actually, from a statewide perspective, we can do isolation and containment and quarantine and identify those folks and snuff out the disease that way. But when it's in the 1,200, 1,400 range per day, that makes it very difficult to continue to do that. So, to my point earlier, continuing to do what we've been doing really well in this state, wearing our masks and socially distancing and not getting together with family and friends who aren't vaccinated, which I'll get to in a point. And continue to do those things until we can get enough folks vaccinated and really create that sense of community immunity where we can begin to take our masks off and begin to relax some of those other guidance.
Well, there is a level of complexity to our response to the COVID and the protective measures we have to take, because there is a population of folks, myself included, who have been vaccinated, and my wife is going to receive her second dose next week. So 3 weeks from now, she'll be fully vaccinated. We have friends who are fully vaccinated. And I know the CDC has released new guidelines regarding folks who are vaccinated. Can you speak to that briefly?
Absolutely. So it's the $1 million question. Everyone asked, and we resumed, was very limited in terms of what they suggest you can do and can't do. It's very to see Mike and I who get together. This is a hypothetical. Of ours who and get together and is we have kids who aren't vaccinated, obviously, and our friends have kids who aren't vaccinated. That's a different scenario where both adults who've been together without having kids. What they're suggesting is only folks who are fully vaccinated can get together in small groups. There's no way to verify isn't vaccinated. Guidance is really most of which probably, but right now, and engaged are fully vaccinated is not those nuances that I just described.
Okay, that sounds like me and my friends and my family. We don't gathering. Us vaccinated. I don't want to spread the virus to someone else. Now, speaking of vaccination, I know that there has been a change in the registration procedure in Clear Creek County, and if there are people that are out there who are over 60 who haven't been vaccinated yet and want to get onto the list for vaccination within Clear Creek County, can you walk us through that a little bit? I know that you're not an expert on the actual paperwork and all that, but I know you have some knowledge of that as well. What can you tell the folks step by step? How do they go about that?
Absolutely. So if you know someone or you are that someone who is 60 years of age or older, please go to the Clear Creek County website and the public health website and click on the COVID viral particle that's there to get more information. And if you scroll down, it will say if you're interested in scheduling a vaccine at one of our clinics, click this link. When you click that link, it will take you to PrepMod, PREPMOD website. It will say it's an external link. If you want to go there, click yes. It will take you to that. it will show you our, and similarly through our Facebook page as well, that link is on there. It will show you times that are available for a clinic. For instance, tomorrow we're having one. All those spots are filled already. But at the bottom, below the time slots, it says add to the wait list. Click on that link or click on that little dot. It will take you then to where you can register. If you are 60 years of age or older, please fill out all of that information, and you will be basically, although there's no spots available, for instance, tomorrow, but you will bubble to the top of our list on the wait list so that next week when we have our clinic, we will then begin to take those individuals who are 60 plus and plug them into spots as they become available next week, for instance. That's the process moving forward. We're no longer creating a list on Google or anything like that. This is now the only way to get scheduled for an appointment. So if you go on there and you happen to be on there and appointments become available, click on one of them that's convenient for you and schedule yourself. But if there aren't any available, please do add to the wait list at the bottom there. It says, click on that, enter your information, make sure you inform us as to how old you are, et cetera, and those questions are on there. In addition to any other pieces of information that are relevant. So if you're below 60, for instance, and you do have significant underlying health conditions, that is one of the qualifiers on there, right? Or you are in agriculture or frontline worker, another one on there. So those sorts of things, based on the tier, will sort of bubble you to the top of that list, because we now have many people who are going on there who don't qualify under any of those sorts of things right now, and we're not vaccinating those folks. We're trying to vaccinate all of those who are qualified based on the eligible criteria for that tier.
So the good news is that if you are 60 or older or any age with some severe comorbidity, you can sign up on this list. And by the way, everyone, that website is clearcreekcounty.us, and there's you go on the home page of Clear Creek County, and up at the top there's a link. You just click on it, and it'll bring up the COVID page, and you go down a little bit on that, and it's that link that the doctor described to register. And I understand that someone is actively monitoring that page to put the folks who are the most eligible for vaccines at the front of the line. Is that correct?
That's correct. And if you do know folks who don't have access to a computer, please give us a call, and we will work with them directly via telephone and get them scheduled. So if you know of anyone out there who doesn't have access to a computer or doesn't know how to use one, please let us know. And we will get them scheduled and get them there. We also now have transportation available. The Prospector bus out of Georgetown is going to be making regular trips. Once individuals are identified in Georgetown or Silver Plume or wherever they may be in the county, there'll be certain days where we pick folks up, bring them to the vaccination clinic, and then take them back to where they need to go. So that is available for anyone who does not have transportation and is in need of transportation. We are more than happy to provide that.
And for our listeners, all of that contact information by phone is available on that website at clearcreekcounty.us. All right, Doc, I know that you need to get going here pretty quick, but I wanted to give you an opportunity to talk about the virtual town hall coming up this Thursday.
Yeah, thanks for that, Mark. So we're having our monthly virtual town hall with yours truly and our Office of Emergency Management with Suzanne, and Alyssa Dinberg is going to be doing a presentation on all of the economics of COVID so far in terms of funding that we've received and disseminated, as well as a potential or a survey that's going to be coming out the 15th, I believe, of March in terms of the COVID impact. We're trying to assess that from the county just to understand what services are needed potentially now and in the future moving forward based on the impacts of COVID. So I would just say to everybody, So the town hall is this Thursday. It's from 6 to 7, usual time, usual channel. You can join via Zoom and or Facebook Live. We will be presenting some stuff, as we usually do, and then spending the bulk of the time answering your questions. So please bring your questions. We will have answers, and hope you can join us on Thursday night at 6. I would just say to everyone, please be patient. We're getting people vaccinated as quick as we can. My staff is working absolutely tirelessly 7 days a week to try to get this rolled out. As we receive vaccines, we will disseminate them to the most needing, and then move down the list as we go and as we receive vaccines. As I promised before, we will vaccinate everyone in the county who wants one. Some people ask, why are we vaccinating people from other counties? This is a pandemic. It is a mass vaccination effort. It is an all-hands-on deck. So vaccinating our neighbors to the east and the north and the south and the west actually benefits us as a county. Those folks come through our county on a daily or weekly basis. So vaccinating any and all around us is really our priority. We are obviously vaccinating Clear Creek folks, both who live in the county and work in the county, and we will get to everyone as quick as we possibly can. Be patient. We will get to you, I promise.
There are more vaccines on the way, quite a few more. Doc, I'm so glad to hear that the county is going to survey folks for the economic damages that have been incurred from the COVID. I just want to throw this out there that I'd love to see a mental health survey done as well. I just think that there are so many people who have been stressed beyond their capabilities to cope, and they don't have those sort of modifying circumstances to help them cope when they're isolated or without a job. It's just a very difficult situation, and I think we're going to be paying a price down the road if we don't get a handle on that.
Yeah, no, I agree, Mark, and good point. A point of clarification. So the survey will cover a number of topics, which also includes mental health, economics of it, mental health, etc. So you should be receiving one by mail in your mailbox. We can also do it electronically and or by phone if that's the preferred method. So we will have 3 different ways to get that survey out and get the answers back. So please fill it out. It's critical for us to know and understand what the needs are out in the community so that we can address them and get them taken care of.
Well, I wasn't aware that it was such a broad-ranging survey. I'm so glad to hear that. Thank you for that update. And by the way, listeners, Alyssa Denberg is going to follow Dr. Ryan today, and then you can hear her again Thursday night from 6 to 7 on that town hall. Dr. Ryan, thank you so much for your time again today, and we look forward to speaking with you when you have an opportunity in the future.
I appreciate it, Mark. Thank you much. Be well, everyone.
Bye now. Okay, everyone. That's Dr. Timothy Ryan, and he had good news on the availability of vaccines. And just be patient if you haven't been vaccinated yet, and get on that website, clearcreekcounty.us. Follow the links to register yourself. And as was stated, if you're 60 plus or younger than that with a comorbidity, you will, as Dr. Ryan said, bubble to the top of the list. So thanks for joining us, and I'll be back in just a few minutes with Alyssa Denberg.